Worried your facelift might leave you looking different? Well, this is a very common question that patients are concerned about. And many patients think, if I have a facelift procedure, am I going to look different to how I looked before? And this is Nicole Kidman. Her younger appearance, she had this kind of very V-shaped, feminine jawline. And then suddenly she's got these puffy cheeks, it's rounded. Her face just looks different. And so with good facelift and neck lift procedures, you will look the same, just the better version of yourself. But key is we want to avoid these very done appearances. And I'm going to take you through a journey of what I believe from over 10 years of experience in looking after patients with facial aging, completing face and neck lift surgery, devising my own customized vertical deep plane techniques which give natural looking results. I'm going to talk to you why this can happen and how we can avoid the telltale signs of having had surgery. So this is a patient who came to see me who unfortunately had face and neck lift surgery just a few years before, but was disappointed because it hadn't given her a natural appearance. In fact, she didn't feel it had made a huge difference to her. She had visible scars. It had changed her appearance from when she was younger. She used to have like a dimple on her left side, and that just disappeared as a consequence of the surgery that she'd had. And she just felt she didn't look any more rejuvenated. Her scars were incredibly visible. Like her scars were apparent, these white stretched lines around the ears. And so today we're going to look at, what are the telltale signs of having had face and neck lift surgery and how do we avoid them? Well, a good place to start is scars. So like this lady, her scars were beneath the hairline, they were beneath the ear, and they were in front of the natural curves of the ear. And so I've drawn this here. This is a picture taken from my book for patients on face and neck lift surgery. If the scar's beneath the hairline, in front of the hair, the scar tends to be more visible. Whereas with modern techniques, we can do something called beveled incisions, and we can hide the scar within your natural hair so that when initially the hair might be just behind the scar, but as the hair grows back, it will go through the scar, making it more and more difficult to see. And this is shown in this picture where the scar that you can see is on the surface, but because it's beveled at an angle into the skin, well, as these hairs grow back, they grow through the scar and the scar gets more and more difficult to see. So this is a patient of mine where I feel if we make the scar in the natural curves of your ear, so around the very curves here, if we hide it under the hairline and use a bevel scar, it makes it far more difficult to see that scar. So in this lady, she had a lot of loose skin, multiple folds of loose skin in front of the ear. Well, afterwards, there's just a fine line, and this is about 6 to 7 weeks after surgery. The scar then goes behind this is called the cartilage or tragus of the ear, and then it goes under the hairline, and just with a little bit of hair in this area, it hides that scar really nicely. And then behind the ear, well, you could feel the scar because it'd be a bit lumpy bumpy, but it's hidden right behind, so it's difficult to see. So in terms of facial aging, the three things that we often see are a consequence of gravity. And so as gravity comes down, you end up with a squarer jawline, loose skin, a change in the neck area, bands in the platysma area, and all these are signs of tiredness and facial aging, which can be also related to genetics, but often it's facial aging. Personally, I use the golden ratio, which has been used extensively since Greek times during the Renaissance period. A lot of Leonardo da Vinci's work had the golden ratio, which made those paintings just exquisitely beautiful in terms of their design and their dimensions. In terms of facial aging, well, we know there's descent from gravity, we know there's deflation from loss of volume, and we know there's loss of skin elasticity, loose skin. And key is none of these things is overcorrected. So that picture we looked at the beginning with Nicole Kidman, well, we saw that her face is just too full because she's had too much volume restored. And that's because she's had some deflation, but excessive volume will give her more puffy and change in appearance. Similarly, we don't want to take away all the character of a person's face because that also will make them look less like themselves. One of the things that was detracting was she had a relatively small chin. And using the principles of the golden ratio, we can see that her chin lies several millimeters behind her lower lip. That adds to the changes in aging in the neck because it almost concertinas some of the fullness in the neck. Now, one way this can be corrected naturally is bringing the chin forward, and that can be done non-surgically with fillers. Surgically, we can do this with a chin implant, and that means putting a artificial implant on the surface of the natural bone, the mandible, which will bring the chin forward. Now, we don't want to overdo this. We want to keep things looking natural. There are other more extensive surgeries that can be done, such as taking the jaw and bringing the jaw forward. But this is a kind of more modest procedure that will give kind of a natural appearance without doing that. Key with any kind of implant is that it's shaped, sculpted artistically to match your jawline. If an implant is just used without that, it can create a change in the appearance. I personally would shape this implant, which I did for this lady, along the kind of natural blue lines here. And what that will do is match the implant along the jawline, which will give a natural appearance. Her chin has been brought forward, but it still looks natural. Her jawline, her neck, well, it just looks rejuvenated. She just looks the best version of herself. And this is my customized vertical deep plane face and neck lift with a customized chin implant. From the front view, well, we definitely don't want to change a person's appearance if too much is done in the jawline. Sometimes that can be done with fillers or an implant that hasn't been shaped. It will create a squarer jawline, which doesn't look natural. But in this lady, we can see her neck's markedly improved, her jowls, her jawline's markedly improved, and all the kind of facial aging is softened, but not too much. She still has some character in the face, and that character is so important from the nasolabial and marionette areas because that's what makes things look natural. The main thing with healing and recovery is swelling, and so this lady, she did have quite a bit of swelling and pinkness at 2 weeks. However, that's a normal part of healing, and by 6 weeks, that's largely improved. I do things to help faster recovery in my patients. That includes the surgical procedure, vertical deep plane facelift, preserving the natural anatomy. Using sedation or twilight anesthesia means things like your vital signs are preserved during the surgery, so you tend to have less swelling and bruising. And then we can use natural anti-inflammatory medicines and techniques to reduce swelling and aid healing. After surgery, lymphatic drainage. Well, one of my team is specialized in this to push away swelling after the surgery to speed up your healing. With my practice, we have an oxygen chamber and oxygen into the elixir for healing, so that will speed up the recovery after surgery. We can use tools such as regenerative medicine, and light emitting diode therapy, LED, can also help with speeding up recovery. And the most sophisticated LED machines use 3 different wavelengths of light, and it absorbed into the inflammation in the skin, which will speed up your healing. So in summary, well, for this lady, I used a vertical deep plane facelift to restore the anatomy vertically to where it had dropped down with gravity. And previous facelift techniques like smaz facelifting was done towards the ear, and in that early photograph which I showed you, that lady who had that, well, she just didn't get a natural result from that facelift technique. We can use things like the golden ratio to reshape areas that are weak and enhance feminize parts of the face, masculinize certain parts of the face, and that will add beauty to the areas of the face. And I did that for this lady with a chin implant. We can use techniques to aid faster healing and recovery. Well, most of recovery tends to be between 2 to 6 weeks, although the final result is many months after that. My tips would be, in order to get a natural looking result, avoid the kind of like done appearance, done scars, stretch lines. You need to find a surgeon who fits the aesthetic that you're looking for. My personal like is for natural looking results. I don't like people to look overdone or look like they've had surgery. You can look at past reviews of doctors to get an idea of their aesthetic. It's true to say that no doctor has 0 revision rate, but I like to have a revision rate that's less than 5%. Sometimes it's necessary to do a little bit more touch-up procedure if there's a little bit of laxity. However, that should be a minimum. And key is we want to minimize risks. And the risks are of stretching of the ears, like earlobe or pig's ear deformity, stretch scars or visible scars. We want a natural appearance that follows this. My tips would extend to be, always put safety first, and that means your medical history, your mental history, your psychological history, but more your medical health. These are all important in terms of safety. If you've had recent cardiovascular issues, it's important that is really looked after before doing any surgery. If you smoke, smoking can really delay healing, and so it's important to look at how that can be minimized. In terms of natural looking results, attention to detail is the key thing, because everything in the face is millimeters, so we want to look at the millimeters of things that have changed. How much gravity has changed, how much volume has changed, how much skin laxity has changed. Younger people, sometimes people have hypermobility, which can be a factor. We definitely don't want to over volumize the face. Putting too much volume, whether it's fat transfer, whether it's fillers, that doesn't result in a natural appearance. We can use tools such as the golden ratio and how that beautifies the face. And then, of course, how your experience in recovery is also really important. Now, lifting the face vertically is a more modern approach to facelift surgery because it restores anatomy to where it used to be. It means releasing little ligaments that line the center of the face, which is like glue that stick things down. And once those are liberated, the face will lift upwards, restoring a natural lift. However, this surgery does take time and generally takes more than 4 hours to complete. Now, I do hope this information has been helpful for you. If you have any questions or anything you'd like to ask me, please do not hesitate to contact me. Thank you for watching.